In the timeline for HIV and AIDS, these are the years 1995 to 1999. For medical breakthroughs, in 1995, the FDA approved the study of SAV in June, which is a protease inhibitor that targets a cell's protease. HIV needs that specific protein to replicate. In December of that same year, SAV was approved to be used in combination with nucleoside analog medications, which led to a new period of highly active antiretroviral therapy, or HART. December of 1995, that very same year, Jeff Getty became the first person to receive a bone marrow cell transfusion from a baboon. The thought process of the experiment was they were hoping that the natural AIDS resistance in baboons would transfer into Getty, and he's photoed right there on the right. The cells from the baboon did not last long in Getty, but his symptoms greatly improved, and he became an activist for HART and HIV/AIDS research. 1996, nevirapine was approved by the FDA in 1996, as I said, and was the first non-nucleoside reverse transcriptase inhibitor available to treat HIV. 1996, the FDA also approved the first home testing and collection kit for HIV, and they required that the person prepare a dried blood spot, and they would send them to a lab for antibody testing. They could receive the results over the phone, and counseling and other resources were offered. Dr. Gallo that same year discovered a naturally occurring compound, a chemokine, that could block HIV and halt the progression of the AIDS. 1997, the FDA approved Combirvine as HIV medication, and it falls into the nucleoside reverse transcriptase inhibitor. It is in combination of retrovir and apirvir, and combivir can only be used if it is with other HIV drugs. Finally, in 1999, Vaxgen, which is a biotech company based out of South San Francisco of the United States, led the first phase 3 clinical trial of HIV/AIDS vaccine called AIDSvax. The first trial was in North America and Europe, and the second trial was conducted in Bangkok, Thailand. They were both double-blind and placebo-controlled, and each volunteer was vaccinated 7 times over 30 months. The trials were not very successful because everyone kind of reacted differently.
So the next section we discussed was the policies and politics that were used in the years 1995 to 1999. So starting out, they started the first National HIV Testing Day, which was launched on June 27th in 1995. This was started to raise awareness about the importance of HIV testing and early diagnosis of HIV. Also in 1995, the Presidential Advisory Council on HIV and AIDS was established by Clinton and met for the first time. This advisory council advises the White House on and the Secretary of Health and Human Services on the U.S. government's response to the AIDS epidemic. In 1996, UNAIDS, the Joint United Nations Program on HIV and AIDS, began its operations. They lead the global effort to end AIDS as a public health threat. Also in 1996, the U.S. Congress reauthorized the Ryan White Care Act, which provides a comprehensive system of HIV primary medical care, essential support services, and medications for low-income people with HIV. Also in 1996, the International AIDS Vaccine Initiative formed to start a search for an effective HIV vaccine. Then in 1997, President Clinton announced that the goal of finding an effective vaccine for HIV would be a top national priority to find it within 10 years.
In 1998, the Minority AIDS Initiative was funded by Congress. This was a program to improve access to healthcare for minority populations, and through that, $156 million was invested to improve the effectiveness of AIDS prevention and treatment in minority populations. Also in that year, the Secretary of U.S. Health and Human Services determined that needle exchange programs that allowed access to sterile needles for injection drug users, were effective, but the ban on using federal funds for these programs was not lifted. And finally, in that year, the U.S. Congress enacted the Ricky Ray Hemophilia Relief Fund Act, giving payments to those who were infected with HIV from unscreened blood products. In 1999, the first National Black HIV and AIDS Awareness Day was launched, and that was just to, as it said, bring awareness for that minority population. And also in that year, President Clinton formed the Leadership and Investment in Fighting an Epidemic initiative to provide funds for addressing the HIV epidemic globally. He also dedicated the Dale and Betty Bumpers Vaccine Research Center at the National Institute of Health for funding an AIDS vaccine. So during 1995 to 1998, there was only one prominent legal case, and that was in 1998, and that was Bragdon versus Abbott. So Bragdon was a dentist, and he refused to fill any of the cavities for Abbott, who was a woman who had been infected by HIV and was living with it. And the result of this case was that the ADA, the Americans with Disabilities Act, did protect people who had any illness, whether or not there were any visible symptoms, because before that case, you had to have symptoms in order to be protected by that.
So our next focus was aid groups between 1995 and 1999. So we started with the AIDS Vaccine Advocacy Coalition, also known as AVAC. They were founded in 1995 by 9 HIV treatment activists in order to speed up development of preventative HIV vaccines and advocate for HIV prevention in order to end AIDS. They use education, policy analysis, community mobilization, and a global collaboration network to accelerate and deliver global biomedical HIV prevention. In the next group was UNAIDS, which I've already talked a little bit about, the Joint United Nations Program on HIV and AIDS. They started operations in 1996, and they advocate for global action on the HIV/AIDS epidemic and coordinate efforts across the United Nations. They also provide direction, advocacy, and support to connect governments, communities, and the private sector to deliver HIV services and have a global vision for the AIDS response. Next was the Treatment Action Campaign, which was founded by HIV positive activists in 1998. It is an activist group in South Africa, and they are credited with making South African government provide access to antiretroviral drugs for their citizens. And then lastly, the Black AIDS Institute was founded in 1999. Their purpose is to engage and mobilize Black institutions and individuals to confront HIV and end the epidemic. And they offer a number of programs and campaigns in order to fight HIV and AIDS, especially in the African American community.
The very last section we focused on was popular culture in the years 1995 to 1999. The first one we focused on was Rent, and that was directed by Chris Columbus. And it was a musical that premiered in 1996. It focused on 8 main characters, where half of them were HIV positive. The musical just showed the differences in lifestyles of the characters and how each one dealt with HIV positive diagnoses differently. Also, Greg Lou Gannis, he was an Olympic gold medalist diver, and in 1995, he announced that he had AIDS on television. He was diagnosed in 1988, but the 1995 interview with Barbara Walters was the first time he spoke about being gay and being HIV positive publicly. His admission led to an increase in anonymous HIV testing in LA. Our next person was Eric Lynn Wright, also known as Eazy-E. He was a rapper from the group NWA, and that consisted of him, Dr. Dre, Ice Cube, MC Ren, and Yella. He was one of the first major music performers to announce his positive diagnoses. His admission forced the public to look at musicians, and he shared his diagnosis publicly because he wanted children to be educated on the disease. Eazy-E died in 1995 from AIDS-induced pneumonia, and that was a month after his diagnosis. Dr. David Ho is our last person of interest. In 1996, Time magazine named him as the Man of the Year. He was the only person specifically chosen for his work with the disease because before 2014, he was an HIV/AIDS researcher that specifically dealt with heart, and he advocated for the hit early, hit hard. He was able to successfully lower the virus count through combinations of drugs and change the way the medical community looked at HIV. This concludes the timeline of the years 1995 to 1999. Here are our references, and thank you for listening.